The statistics are sobering. Nearly 1,500 people die in the United States every day of cancer. Half of all men and 1/3 of all women develop some form of the disease during their lifetime. And despite medical breakthroughs and advancements, it remains the leading cause of death worldwide.
Cancer is very common. About 1 in 3 Americans will develop cancer in their lifetime. We always blame external factors like smoking, asbestos, radiation, smog, chemicals. But increasingly, there is genetic abnormalities being detected in patients and in their cancers. And these genetic abnormalities are being directly linked to cancer.
Cancer is the devastating disease that strikes people of all ages, ethnicities, and backgrounds. Although research has yet to discover a way to prevent cancer, treatments have made tremendous progress in prolonging and improving quality of patient life.
I've been having a regular mammogram since I was 40 and went for my normal one a year ago about at this time, to which I flunked. The next step was to do the biopsy and the waiting, the awful waiting to find out what it is if I have it. And then the word back that yes, there is cancer.
Scientists and researchers have been hard at work testing and perfecting promising new approaches to cancer treatments. And in recent years, more patients have been able to defeat the disease because of it.
The cure rate of the cancers generally is much improved from 30, 40 years ago till now. It's not just based on the fact that we have better drugs. It's also based on the fact that we have better tools to recognize cancers early, intervene early, and make them curable.
Traditionally, we would see patients with stage 3 and 4 disease. Now we see patients with stage 0 and 1 disease. That translates into survival. The same is true in treatment. Surgery has advanced, more precision in surgery, more minimally invasive surgery. Chemotherapy has been advanced, and also targeting the therapy.
Determined to fight cancer with the best technology and the latest treatments, full-service facilities such as the Sparrow Cancer Center have made great strides in the war against cancer, providing hope for patients in need of new options.
It was wonderful. They were very thoughtful in how this is set up. I just knew I'd be well cared for here. Just seeing that team approach, the different people that you met, and they went through what you would be going through.
The future of cancer care is individualized care. So we are trying really to tailor therapy to each individual patient.
Recognized as a leader in quality care and patient experience, the Sparrow Cancer Center features a team of board-certified physicians, specially trained nurses, and other healthcare providers who not only address the physical needs of each patient, but also work hard to instill hope and empower patients by arming them with the information they need.
The mission of Sparrow Cancer Center is to deliver high-quality care, compassionate care, every time with no excuses.
The Sparrow Cancer Center believes in making healthcare as simple and effective as possible. The multidisciplinary clinics and surgical options available under one roof reduce the time between diagnosis and treatment and ensure that patients are equipped with the best possible treatment plan available.
We have multiple tumor boards and the hallmark of multidisciplinary clinics. That's where a patient comes to a clinic, sees all the experts that are relevant to their care, and then they get one recommendation from that group of experts.
It's an unbelievable experience, is the only way I can describe it. The care, the compassion of people, the thoughtfulness.
Because the Sparrow Cancer Center boasts one of the largest clinical trial programs in the state of Michigan, patients are among the first to benefit from new treatments.
Clinical trials are actually golden standard for development of new diagnostic and treatment approaches. Without clinical trials, we wouldn't know what to do and how to treat individual patients.
The Sparrow Cancer Center is the only facility in mid-Michigan to use a targeted therapy approach that translates into shorter hospital stays and a lower risk of side effects for some patients.
The biggest change in cancer care is individualization. Nowadays, we can carve out critical structures such that only the cancer is treated. The same is true in the genetics that have revolutionized cancer care. Both the patient and their cancer can now be looked at for genetic abnormalities, and certain drugs can be chosen correctly in that situation.
Whether you are interested in cancer prevention and detection or are currently facing cancer, the Sparrow Cancer Center is with you every step of the way. For more information, please visit sparrow.org/cancer.